Stage. Which button do you push? Oh, hi everybody. If you could get seated, we're going to get started in about 10 seconds. So grab some coffee, sit down. Thank you. Good morning. Let's try this again. Good morning. Good morning. Thank you. And welcome to today's event on the 2018 Lancet Countdown on Health and Climate Change. My name is Srili Sutaria Patel. I'm going to be your moderator today. I am with the American Public Health Association, where I'm the Deputy Director for the Center for Public Health Policy. And I'm really proud to say that APHA is honored to be a collaborator with the Lancet Countdown, especially because, you know, one of the opening statements the report makes is humans need clean air, safe water, and vibrant communities in order to thrive, and climate change threatens these foundations of health and well-being. While the health of all Americans at risk, climate change worsens the health inequities with unequal distribution of harm to health. And this resonates with APHA particularly right now because we're starting a new center on climate health and equity, where we're really hoping to engage the public health workforce to enable them, empower them to think about equity, inequity, injustice while we're working on the climate and health issue. And this report definitely does that as well. Furthermore, the report is such a great way to provide sources for action, as many of us are constantly looking for avenues to take on our own action in our own home organizations, and having this report summarize it is just a great way for us to point to something. So speaking of action, I'm going to introduce our first speaker, and she doesn't require any introduction, but I have this lovely bio, and I would be remiss if I didn't read it. Gina McCarthy is Professor of Practice of Public Health in the Department of Environmental Health at Harvard T.H. Chan School of Public Health and the Director of the Center for Climate, Health, and Global Environment, C-Change. In this capacity, she leads the development of the school's strategy on climate science, health, and sustainability, strengthens the climate science and health curriculum, and liaises with climate science leaders across the university. She's been a leading advocate for common sense strategies to protect public health and the environment for more than 30 years. She served under President Barack Obama as the 13th administrator of EPA from 2013 to 2017. Her tenure at EPA heralds a paradigm shift in the national environmental policy, especially linking it to global public health. She led EPA initiatives to cut clean air pollution, protect water resources, and reduce greenhouse gases, and strengthened chemical safety to better protect more Americans, especially the most vulnerable from negative health impacts. She signed the Clean Power Plan, which set the first ever national standards for reducing carbon emission from existing power plants, underscoring the country's commitment to domestic climate action and spurring international efforts that helped secure a Paris Climate Agreement. She also worked with the United Nations and the World Health Organization on a variety of efforts represented by the U.S. on global initiatives to reduce the high-risk sources of pollution. After the Obama administration, she became a senior leadership fellow at both the Harvard Kennedy School of Government and the Harvard T.H. Chan School of Public Health. In addition to her work at Harvard, she currently acts as an operating advisor at Pegasus Capital Advisors, a private equity firm in New York focused on the intersection of global sustainability, health, and wellness. She holds a Master's of Science in Environmental Health Engineering and Planning and Policy from Tufts University and a Bachelor's in Social Anthropology from the University of Massachusetts at Boston. So if you all will please join me in welcoming Gina McCarthy.
Well, that really long bio made me feel really old. But thank you for it. And Dr. Benjamin, thank you for your leadership at APHA. I am just so excited the way we are blurring the lines between health and climate. It is so about time. And so I'm very excited. So first of all, I'm excited to be the first keynote speaker. I know there are many wonderful people that will follow, but I am really excited about the Lancet Countdown. I want to thank them for all of their support. I want to congratulate Dr. Hess and Dr. Salas for all of their terrific work on pulling all of this report together. I know that we have seen a number of climate reports of late. All of them are of equal importance and look at climate and the relationship between climate and health in very different ways. Yes, the IPCC report was terrific. You know, it was obviously a serious wake-up call to all of us. It was telling us that we are seeing climate. It's real. It's happening today. And there are serious economic consequences. And we have to start addressing those consequences today. But the good news in that report was that we actually have the scientific know-how. We have the technical capacity. And we have the economic system that we need in place to actually address climate. What we fail to have is the political will. And that's what we are all struggling to push. And the National Climate Assessment, which is a report I always love, I love it just because it was, well, first of all, it was released on Black Friday, which turned out to be a very good strategy if you want to keep it secret. It's made a top headline for the past week, which is very fun to watch. But it was a report that Congress required of a bunch of key scientists and agencies across the federal government. And what I really like best about this report is that it continues to delve down to move climate science down to a more personal level. And in the case of the National Climate Assessment, it takes a look at what's happening in the United States of America region by region. It talks about what is happening that today and what we can anticipate may be happening, and it makes it abundantly clear that climate change is already happening. And it is the burning of fossil fuels which is the primary culprit that we can attribute a great deal of this change to, and it's the culprit that we need to take action against. And the sooner we do, the sooner we lower greenhouse gases, the better we are, but adaptation is going to be critically important. And both of those reports told us that time is of the essence because changes are happening even more quickly than we ever predicted before, and we need to start acting today. And so what we really need to do, again, is to take a look at what other information we might have available to us that can build that political will. So let's all agree we have great technologies out there. They're already functioning. They're already in place. Clean energy is happening. What do we do to make sure that that move continues and accelerates? What do we do to actually motivate people? That is where this report is incredibly important. That is where the rubber meets the road, because this report is different than the other two, which is why I think it's so important, because it provides another layer of understanding about the impacts of climate change and the benefits of climate action. It focuses on the risks that climate change poses to our personal health. Personal health. It means that climate change is happening and it's real, and it's not just about a faraway place or something that's going to happen in 2050 or 2100 or something that's just going to happen to people in other countries. It is real, and it's happening today, and it is impacting our health today, and it can rob our children of their future. It is something we need to act on if we want to protect ourselves and our families. It's something we need to act on if we want to meet our moral responsibility as citizens of the world, as citizens of this country, and as parents and as relatives of little kids that are being born today, one of which in August was my first grandchild, my grandson. Do it for him, or else I'll get very upset. Because he's my face of climate change. And it focuses not just on those risks. And it doesn't talk about the health of the planet. It really focuses on impacts of climate change to our health today and what we see moving in the future. And what's really intriguing about this, because a lot of people, including some leadership in Washington, want to keep denying that climate change is real, even in the face of, absolute evidence to the contrary. But what's interesting is that this report is also different, not because it just focuses on health, but because the people who have actually authored this report are actual people who work in the public health field. Whether they're researchers or people who work in healthcare. They are the people that we go to on a daily basis that advise us on our personal health, that we go to when we're not feeling well, when we have problems. We trust and rely on the people who write this report every single day. We cannot deny that they are trusted advisors, that we have to listen to them and stop denying science fact and stop talking about the idea that scientists who present real information, even the stuff that's hard to listen to, we have to stop thinking about them as somehow being compromised or incorrect or on the take, and start listening to the science. And these trusted advisors, if you advise them to care for you when you go into a hospital, you ought to listen to them when they develop a report like this and put their necks out to describe the health challenges and what we need to do about it. That's what's important, I think, mostly about this report, is not only its focus on health, but who's writing it. But even more important than that, this talks about the benefits of taking action on climate change. Now, that's where I think it's a yoo-hoo moment. It's not the ancillary thing we talk about. It is the absolute fundamental thing that this report focuses on. Because finally, we are moving from the woe is me, climate change is awful, to the wow, let's think about these climate actions and what do they do more than stabilize the planet? Well, what they do is address public health impacts today. The impacts we're seeing. We can actually use climate investments as an opportunity to invest in health today. Critical investment that we need, because 9 million people across the world die every single year as a result of exposure to pollution. And let's not forget, carbon pollution that fuels climate change is pollution. And when you grab that and suck that out of the system, you take with it air pollutants that are killing up to 7 million people every year across the world. So let's stop looking at climate change as a cost and start looking at it through a health lens and make it the best opportunity we have to invest in public health today. It is the best thing we can do for our lives today, as well as for the future of our children. It moves us beyond the gloom and into how do we build a healthy, more sustainable, and more just future. Because if you look at the lives of those 9 million people that are cut short every year, you will see that 93% of them come from low and middle income countries. Carbon pollution is not an equal opportunity killer. it always goes after the most vulnerable. It is always going to impact the elderly and the young people. It's going to impact minority communities, the most vulnerable among us, the homeless. I went to California 2 weeks ago at the height of the fire, and I thought I was back in Beijing. If anybody in this country doesn't think that climate change is happening now, then look at pictures of people walking the streets of San Francisco with masks on to protect themselves. I talked to some young women who couldn't make a meeting we were going to because they were driving their asthmatic kids to live with their grandparents in another spot until the smoke abated, until the air pollution went down. And they were also bemoaning the fact that they are some of the few who actually have the capacity to have a car to drive their children out, because we know that the highest levels of asthma are not in the people who have that capacity. It is in the families that have been left behind constantly. And it's time for us to think about climate action not as something we're doing for the planet, but something we're doing for our health, something we're doing for equity, something we're doing as part of a larger international organization where we are responsible still for being the second largest greenhouse gas emitter. So as much as we want to pat ourselves on the back about clean energy and energy efficiency, it is not the time to pull out of the Paris Agreement. It is not the time to roll back regulations. It is the time to roll up our sleeves. It's the time to demand the political will. If everybody in this country understood that their children's health was at risk, then they would demand political action. That is what we saw in the midterm election. We saw women and we saw others who were advocating for climate action and advocating for action on environmental protection from pollution, and they got elected and they are going to demand change. We should be standing behind those politicians, because you can't just make promises to protect my grandson. You better deliver on those promises. That's political will. And if health can't drive change, then I don't know what can. Because I've been in this business a long time, and believe me, it's the only thing that does. So I feel like we are on the cusp of something really great here with this report and with the actions that are now being taken across this country that don't rely on the federal government, but instead are about every community standing up and speaking for themselves and taking action. It's about 2,000 mayors, and it's about 2,000 businesses and multiple individuals across this country who don't care that the federal government stepped aside because they can do it on their own. Because in this country, anything great has always started at the grassroots level and worked its way up. So we're going to continue to make progress, and progress is happening. But we can multiply that. We can manufacture huge engines of change if we use health as the fuel. That's what we have to do. That's what this report helps us do. That's what we will continue to do working forward. Now is the time, not tomorrow, not the next day, and our kids are the motivator. Thank you very much.
Thank you, Gina. Now it's my pleasure to introduce you to Dr. Jeremy Hess and Dr. Renee Salas, who will share some highlights from the two reports. Dr. Jeremy Hess is an author on the Lancet Countdown Global Report, and he's a senior author of the U.S. Brief. He is the co-director of the Center for Health and the Global Environment at the University of Washington and an expert in climate adaptation. He is an emergency medicine physician at Harborview Medical Center and the University of Washington School of Medicine in Seattle, Washington. And we also have Renee Salas, who is a lead author of the 2018 U.S. Brief on the Lancet Countdown. She is a Burke Fellow and affiliated faculty at Harvard Global Health Institute with a focus on climate change and health research. She's an emergency medicine physician at Massachusetts General Hospital and a Harvard Medical School in Boston, Massachusetts. So if you can join me in welcoming both Doctors Hess and Salas.
Good morning. It's really great to be here. I'm really excited to see all of us here. Oh, thank you. Really excited to see all of us here so focused on climate and health. I'm going to give you an overview of this year's Lancet Countdown Global Report, set the context for the U.S. briefing, and the stories that go along with it. The Lancet is one of the world's top medical journals. It's also perhaps the oldest. It has a long commitment to evidence-based practice in both medicine and public health, and a very substantial commitment to global health. And the Lancet is singular among the journals in our field in its regular, insistent focus on climate change as a health issue. Its initial engagement was exploratory, where it worked with experts to determine just how big a threat climate change might pose. And as you can see here on the left, the result of that inquiry was the finding that climate change is the biggest threat to public health of the 21st century. As Gina said, that message is motivating, but also deflating. And the health experts recognized this and decided that it was also important to highlight the next part of the story, which is that climate change represents a tremendous opportunity for action. As we act on climate change, we act on a whole host of other exposures that are bad for people's health. The dialogue continued at the Lancet with the institution of an annual report focusing on progress related to climate change and health. And we have just released the 2018 report. The reason that you've seen so much around climate change and health in the last week is that we're about to enter the Conference of Parties, an annual agreement, and everyone wants health to be at the forefront of the negotiators' minds as they're going in to consider next steps related to climate change. And the Lancet Countdown report provides a global update on progress related to impacts, adaptation, mitigation, reduction of greenhouse gas emissions, and financing related to climate change, adaptation, and mitigation in the health sector specifically. The Lancet Countdown has prepared a video that outlines the key findings from this year's report much better than I could. So I'm going to play that for you, and then we'll go through some key indicators and set the stage for what's happening globally and what's happening here in the U.S.
Health professionals around the world are increasingly responding to the growing medical challenge posed by climate change, which threatens to undermine the last 50 years of gains in public health. The Lancet Countdown, tracking progress on health and climate change, places a finger on the pulse of this vital issue, documenting the response to climate change and demonstrating what action, or the failure to act, means for our health. The 2018 publication tracks 41 indicators across 5 key domains in health and climate change, continuously strengthening its methods, data, and analysis. The environmental systems that our good health depends on are being eroded. This year's report highlights concerning trends in heat and heat waves, infectious disease, and declining food security. As climate change continues unabated, 51% of global cities expected to seriously compromise their public health infrastructure. Despite this, the world continues to stall, with limited progress made to reduce greenhouse gas emissions or to build adaptive capacity. Even though we've seen rapid rates of deployment in wind and solar power driven by cost reduction, our global energy system produces a similar amount of CO2 per unit of energy as it did in 1990. Coal, a major source of these emissions, is responsible for over 460,000 premature deaths from fine particulate air pollution each year. But there is still time for effective intervention, and the beginnings of a transition can be found across the world with the rise of non-polluting cars, the construction of more livable cities, and cleaner sources of power, and with a growing response from health professionals. In whichever direction we head from here, whether we seize these opportunities for public health or allow our health systems to be overwhelmed by new and growing threats, it is clear that the nature and scale of the response to climate change will be the determining factor in shaping the health of nations for centuries to come. Visit the Lancet Countdown's website for its report on the state of health and climate change across the world in 2018.
So you saw there an image that I'd like to highlight, which is the crossroads. We are at one. And in public health and medicine, we use evidence. Patients come to us and expect us to rely on the best evidence to provide them with outstanding treatment. And we use different kinds of evidence. We use evidence that helps us diagnose and helps us give a prognosis. We are very clear about the diagnosis here. And we're also quite clear about the prognosis depending on the road we take. We're at a really great time in terms of progress around global health. From 1990 to now, we've made great gains, particularly in the lowest income parts of the world, as you can see here. Each of these lines represents progress from 1990 to 2015 in different countries around the world regarding life expectancy, which is a general indicator of health. There are many more. And almost universally, the trends have been positive. Climate change, unfortunately, threatens to undermine those gains. The report outlines 4 key messages, the first of which is we're seeing impacts, we're seeing them around the world, they're widespread, they're damaging, they're frightening, and they are just the beginning, depending on the path we take. The next message is one of delay. We've stalled. We're here today to try and get things started again, but we need concerted, comprehensive action. We are somewhat behind the 8 ball. And Renee and I see patients all the time who are in extremis. They come to us at their worst moments, when they've been injured, when they've suffered a severe medical catastrophe. And it's a teachable moment. It's a time to tell them what has happened, why, what risk factors in their lives might have caused them to get to this point, and then what we can do about it together to reduce their risk going forward. And this is our opportunity. Our opportunity is to continue those gains in global health through aggressive investment in reducing pollution, carbon pollution, and the air pollution that results from it. It's not only air pollution. We can change the way we produce energy and reduce all sorts of different criteria air pollutants. We can change the way we travel and improve our cardiovascular health and reduce our rates of diabetes. This is not just a problem here in the United States, but globally. These non-communicable diseases are rising in incidence everywhere and cause a substantial burden of disease. And increasing opportunities for active travel will reduce that considerably. We can change the way we eat lower on the food chain, lower our cholesterol, and lower our risk for cardiovascular disease. The co-benefits abound. The last key message from the Lancet Countdown report is that health is central to all of this, and engagement with the health sector is paramount, which is why I'm so excited to see everyone here today. The report covers 5 key areas. There are copies here. I encourage you to take them and browse through. I'm only going to cover a few of the 41 indicators that we went through in the report. But the 5 key areas relate to impacts, adaptation, mitigation, finance, and public and political engagement, all related to climate change and health. Climate change and health is getting increasing notice, and it's because people trust health professionals to provide them with reliable evidence. That's all we're trying to do. We see a threat, we're trying to characterize it, and highlight opportunities for improving health. And what we see is that there are a whole host of dangerous exposures that are getting worse. And one of them is heat. Heat is sort of the sine qua non exposure related to climate change. And of course, the world is warming. The world where people live is warming actually considerably faster than the globe in its entirety. So heat exposure is increasing significantly. And the report highlights how vulnerability to heat is increasing the world over in high and low and middle income countries alike. Heat not only causes heat exhaustion, heat stroke, but it impairs our ability to work effectively. It causes injuries in the work environment. I've seen patients who have come in with kidney failure because they were working in very hot conditions installing a roof. I've seen patients who've died of heat stroke from agricultural exposure to heat. I've seen more of these patients in recent years than I did at the beginning of my career. What we're seeing worldwide is a reduction in labor capacity related to heat. It's decreasing our productivity generally, and particularly in these professions that are highly exposed. We're seeing more weather-related disasters. This is no surprise to you. Our country's gone through many of these in the last 2 years, and Renee's going to be talking more about that. These patients, when we see them, are desperate and bereft. We've seen too many already in our careers, and I fear that we'll see quite a few more going forward. The losses that come with those disasters are increasing. Unfortunately, less than half of them generally are insured. So recovery efforts are impaired, even in wealthy communities. This is something that we have to reckon with. It's not like we can continue to go through these disasters and recover, take the insurance, and rebuild. It undermines our capacity going forward. When I was a resident, I saw patients who were evacuated from New Orleans to Atlanta for Hurricane Katrina, and saw several of them come through the hospital for medical screening because they had mental health issues and other health problems and had been without their medication and were decompensated in front of our eyes. Over time, I saw fewer and fewer of them. And I think part of that was because some of them were so vulnerable that they had passed away after the incident. The risk for suicide after these events is very high. There's substantial long-standing mental health impacts associated with displacement, separation from communities, and the losses. The economic losses alone are very difficult and have significant long-term impacts on people's health. The world over, countries are taking stock, including ours. Gina mentioned the National Climate Assessment, which the 4th edition came out this year. We're taking stock of our impacts, but not all of the world is actually taking the kind of action at a national level that's needed. We don't have a national adaptation plan here in the United States. We have local adaptation plans, and we have a very robust response from the public health sector. Local health departments across the country are responding very proactively and have developed a whole host of innovative programs focusing on that particular hazards that they're facing, whether it's sea level rise or heat exposure, wildfire smoke, population displacement. But we don't have the national plan that we need. And unfortunately, what we're seeing the world over is we may be at a threshold. We're starting to see that we've peaked in terms of, well, peaked may not be the right word, but we've seen a decline recently in preparedness for disasters that correlates, unfortunately, with what's needed for climate change adaptation and readiness. And our carbon intensity is essentially unchanged. In almost 30 years, we've seen no change in the amount of carbon we use to produce our energy. It's a substantial opportunity. But, again, we're at a crossroads, and we see our momentum is going down one particular route. It's going to take a substantial effort to try and turn. So the messages from the global report, impact, delay, and opportunity, are the context for the U.S. report that Renee is going to come and talk with you about. And health is a theme that runs throughout all of them. I thank you for your time and look forward to discussions, and I appreciate you being here and engaging with us.
Thank you so much, Jeremy. Thank you, all of you, for being here today. I know you all have very busy schedules, and I really appreciate you taking the time to join us. So as a practicing emergency medicine physician in a busy urban hospital, I have a first-person view into the ways climate change is harming the health of Americans. And this is especially the most vulnerable: children, the elderly, those with chronic medical conditions, and the poor. Because of this, viewing climate change as a public health emergency is second nature for me. It is exemplified when I have to tell the mother of a 4-year-old who has had her 4th visit in a week for an asthma exacerbation that she needs to be hospitalized. For me, climate change is front of mind because I know that the reason she's having these exacerbations is because of the rising pollen levels driven by climate change. Or an elderly woman from Puerto Rico who literally came to my emergency department from the airport, luggage in tow, and she had a bag, a Ziploc bag, that had empty medication bottles that she had not taken in weeks, that still had a stick and a branch within it that she brought with her from Puerto Rico. She was a climate refugee in Boston. Or when I treated a young father of 3 who came to my emergency department with heat stroke, which is the most severe form of heat illness. He was a construction worker, and he felt young and invincible. But I knew that outdoor workers are more at risk for heat effects because of climate change. So as you digest all of the data in the global report and the US brief, I hope you realize that there is a personal story for every statistic that you see. There's a patient sitting in my emergency department, in Jeremy's emergency department, who represents the true, often hidden cost of climate change. Since we can't tell everyone's story, we need this data to highlight the millions of Americans who are truly being impacted by climate change. And that's why the annual data provided by the Lancet Countdown and the US brief is so critical. This country brief, there are 11 in all this year, they allow every country to realize that this global report applies to them. And like an annual doctor checkup, it reminds us that we have the ability to prevent the harms from climate change, but we have to take action now. So as we embarked on this somewhat arduous process, Jeremy and I approached this task as emergency medicine physicians, and that is prioritizing two things: teamwork and patients first. So teamwork. I hope that none of you have ever been in an emergency department, or your loved ones have, but if any of you have, I hope the one thing that you have noticed is that when you see doctors, nurses, pharmacists, technicians, all around a patient trying to save their lives, it is that teamwork that is saving the patient's life. So for the US brief, we created a group of over 40 advisors, many of whom contributed to the brief directly from 25 different organizations. This is similar to the Lancet global process. And this breadth of the US climate and health world ensured that the brief represents and highlights the key insights, wisdom, and knowledge of some of the best minds from multiple lenses. And we are stronger together. And this team of health professionals did this because we are committed to our collective patient, the Americans who are suffering. We received no compensation, and we did this on top of our already busy schedules. So let's talk about patients first. When I walk into an emergency department, it is my job to determine how the health of that patient is being harmed. Is this chest pain truly a heart attack? And the patient comes in, often fearing the worst. They're convinced that their abdominal pain is truly cancer. In this case, the worst is true. The rising greenhouse gases that we are pumping into our atmosphere, coupled with the toxic air pollution from the fossil fuels being burned, are harming health. And they may be invisible, and they may be often ignored, but they are deadly. No one in America is immune to this, and every geographic region within this country have their own vulnerabilities. Heat waves are more frequent and lasting longer, putting more Americans at risk for the detrimental health effects of heat. In 2016, 12.3 million more Americans were exposed to heat waves compared to the historical baseline. And the recent fourth National Climate Assessment that just came out last week, the Midwest is projected to have the largest increase in deaths from heat. And there could be up to an additional 2,000 additional deaths per year by the end of this century. And while this has impacts for all Americans, it especially impacts outdoor workers. The U.S. has lost nearly 1.1 billion labor hours between 2000 and 2017. But again, the human health impacts are much worse. The National Climate Assessment again points out that up to 68% of heat-related deaths in this country are from outdoor workers. So we are still discovering the true impacts of climate change and its effects on health. But this data can highlight the power of data to predict where health is going to be harmed in the future, so we know how to protect it. Emerging research reveals that heat is causing increased bacterial resistance to antibiotics, decreased cognition for young students who are working in non-air-conditioned buildings, increased suicides, and worsening mental health. So this forces us to imagine a hotter world with untreatable infections, our children struggling to understand math during a heat wave, and more Americans facing complications of mental health with untold implications. So extreme weather, such as hurricanes and wildfires, they're also intensifying under climate change with profound implications for health. These events are often horrific, and we are distracted and focused our attention on the immediate event and the deaths that follow immediately after. But this often hides the true hidden human health costs. While there are significant challenges to really trying to measure what these true health costs are, and Hurricane Maria is a prime example. Hurricane Maria, which received a lot of media attention in regards to the statistic, had an official death toll of 64, but later estimates were well over 5,700. And that's because the basic tenets to protect health broke down. The reality is that these same challenges and data issues are common to many of the extreme weather events that we have witnessed in our country. The official death toll for Hurricane Florence is currently 51, Michael, 46. But we know that the true death toll are much higher as the hidden negative health impacts are still being felt today. Wildfires are no different. Air pollution overall has been increasing in the US since 1988, but has been rising in some Western states driven by these more intense wildfires. So the recent horrific wildfire in California has a current death toll of 88 as of yesterday. However, we don't see the countless more lives that are being taken because of this worsening air pollution. The CDC reported in May that vector-borne illnesses have tripled, with tick-borne diseases having the highest numbers. But even outside of vector-borne diseases, the Lancet countdown reveals that conditions that foster the growth of the bacteria Vibrio in ocean waters are becoming more favorable. This bacteria can cause significant infections for humans. And this means that in the near future, Americans may become ill and suffer more health impacts through direct exposure to this bacteria, through either direct exposure with swimming or consuming the bacteria. But this data can guide us and allow us to know where these future impacts for health are so we can work to prevent them. While these are just a few examples of how climate change is impacting health today, there is hope because thankfully we have a treatment. The Lancet Countdown provides concrete evidence of the solutions or treatments that we have today. It gives us an honest picture of what we're doing and what we need to do. Thus, you could think of the US brief as common sense medical advice. Prevention is always the best medicine, and action towards this treatment is happening. America is decreasing the carbon intensity of their energy system, and they're implementing low carbon sources like solar and wind. And efforts at state and local levels are allowing us to reach about half of our current Paris Agreement commitment. But as the recent UN report highlighted, we need even more aggressive action to reduce our greenhouse gas emissions if we're going to protect health. The protection of Americans is also occurring at local and state levels through the actions of mayors and governors, and remarkable work that is being done at local public health departments. However, these efforts are grossly underfunded. Only 5% of the total money spent in the last fiscal year in the United States was put towards health sector adaptation. This has to increase if we're going to let our local public health departments protect the health of their citizens. And the voice of health professionals is rising. This event is a perfect example of that. And it has been shown that health professionals are the most trusted messengers of this message. We have to train our own so they can educate their patients and protect them. Thankfully, the health sector is also stepping forward and taking the decisive action that's needed. Healthcare is modeling the way forward as they improve health and save lives by committing to 100% renewable energy. So with the diagnosis being made that the hidden costs of climate change is revealed, I take you back to the emergency medicine mindset: teamwork and patients first. This is how we're going to solve this public health crisis. We need all of the sectors that are represented in this room and that are watching on the live stream to join together and take the action in your hospitals, in your cities, and in your states. But we have to do this together. We are stronger as a team. We need to put the health of Americans first by implementing the treatment, reduction of greenhouse gas emissions. So how do you know, or how do I know that we will do this? It's because I've been in these trauma bays and I've watched teams bring a patient back from the brink of death after a diagnosis has been made. I have seen firsthand the power of teamwork in putting patients first. America, our collective patient, has the diagnosis. It is time for all of us to step into that room and to take action together. So in conclusion, I end with one question. 97% of climate scientists agree that climate change is happening. And the evidence in this report and this brief show conclusively that climate change is harming health. So if 97 out of 100 doctors told you that you had cancer, would you seek treatment? Or would you listen to the 3 doctors that told you that you had a clean bill of health? Thank you.
Thank you both. We're going to do Q&A now. So there's a microphone if you would all line up with your questions. I have to say, what better equipped people to write the report than 2 emergency doctors. I heard some really great things, including climate change is the greatest threat to human health, but also possesses the greatest opportunity. And that's something that I think a lot of us appreciate, is that it's not just all gloom and doom, but it's really a chance for us to come together on solutions and really make an impact. And the other thing that really resonated with me is when you said, Dr. Salas, no one in America is immune to the health threats of climate change, and there are more unique impacts falling in the regional areas. And so while we do want broad sweeping solutions, we have regional solutions for regional problems as well. And it's a both and, it's not one or the other. So with that, are there any questions from folks in the audience?
I'm going to go ahead and kick off with a question, if that's okay. It's kind of cheating because I knew this would happen. I'm also going to note that we're behind schedule, so just roll with us. We'll have the same things happening. They're just not going to happen on time. My question is, Dr. Hess, Dr. Salas, it's been a pleasure to work with you both. I know you both live crazy busy lives with very little sleep. What drives you personally to take that little time that you could be sleeping to work on climate change as almost a side project in your lives?
Thanks, Paige. What drives me is, it's concern for my kids. I'm going to give it to Renee.
I have seen the patients walk into my emergency department, and I provided that treatment to them in that immediate moment, but I can't help but look upstream and think about what brought them to my doorstep. And that is truly what led me to approach the public health sphere, because I'm tired of just treating the patient in front of me and having them come back 2 days later. And I truly believe that this is the biggest public health emergency, I would argue ever, but I would say definitely for our generation, and we have to act on it. And I couldn't sit aside and not do that, what needed to be done. And so there's also so many knowledge gaps, and that really what drove me to try to pursue climate change and health research, because we need to fill that knowledge gap. Again, data illuminates that hidden human health cost that is occurring. And so this is what keeps me up at night. This is what I'm passionate about. And I feel honored to be able to work in this sphere with all of you.
Thank you. We have another question?
Yes, thank you for your time and your presentations. So I just spent 3 years working for a DC-based multi-specialty physician practice trade association. And over the 3-year period, we could not, despite my prompting, urging, begging, pleading, bribing, we could not bring ourselves to discuss this subject. Even as an e-news, weekly e-news item, report came out, it said X. Couldn't even say that. So my question is, relative to the profession, physician practices, can you get out of your lane?
We won't get out of our lane. This is what we do. And this is what we're going to be consumed with going forward. Part of why I do this work is that I know the generation of residents that I'm training right now will be dealing with cascading complications from climate change. Fortunately, I'm in an environment that supports that conversation. It's open, it's wide-ranging, it's collaborative, it's collegial, and there's widespread concern. So I know many parts of the medical and public health communities that are very open to this conversation and eager to have it, don't necessarily have all the information they need to move forward effectively, but are concerned. And that concern in the younger generation is pretty dramatic, actually. I think there's quite a, I'm contacted now on a weekly basis by medical students from all over the US interested in this issue. I'm contacted quite regularly by emergency medicine residents from all over the country concerned about this issue. And importantly, they're not only concerned about climate and health, but they're concerned about equity, and they're concerned about homelessness, and they're concerned about all of these other cascading and interacting issues that bring people to the place of last resort, which is the emergency department. It's the only place that everybody can access some degree of health care in the United States. We're the safety net. We're the ones that try to catch all of this when things go awry. And I'm worried about that. I would be curious to know more about what the barriers were to that conversation in your group, and what strategies you tried to engage people. But ultimately, from my point of view, this is just about evidence. You can debate this just like you would evidence regarding what kind of stent you put in someone's coronary arteries. We are not trained in climate science, but neither are we trained in cardiology, but we talk about their evidence and evaluate it. And we've evaluated the evidence related to climate and health and are extremely concerned.
So we are scientists with a human face. And we can tell those personal stories, but we're scientists. And I think we rely on the Hippocratic Oath, which says that we have to protect our patients from any and all harm that is occurring to their health. And I think we really have a historical model to step on, and shoulders to stand on, I should say. And there were physicians who gathered around the nuclear proliferation, and they said that it was their Hippocratic duty to protect their patients and to warn them of that harm. And that is exactly what we're doing today.
Great, thank you.
Thanks. Keith Martin, the Executive Director of the Consortium of Universities for Global Health. First, thank you so much for the incredible work you and the fellow commissioners have done on this timely and vital report. I want to connect the powerful message that Gina McCarthy just gave to us to your excellent work and ask you a question. We know that one of the great challenges we're finding in academia is to mobilize our folks to translate this work into everyday speak so we can mobilize both policymakers and the public to act. And for them to act, they need to care and to understand this, as Ms. McCarthy said, in a personal way. So I wanted to know whether you've thought of, in the communication products that are going to come out of this, how are you going to tell the stories that you've described in your comments, that Ms. McCarthy's described, in ways that not only appeal to people's minds, but importantly, affect their hearts? Because we know that if we can evoke an emotional response to people, they're far more likely to get up, get active, and get implementing the things we know are going to save lives. Thank you.
So Howard Frumpkin has a classic line that I think I will invoke here, and that is, numbers numb and stories stick. And again, as I had just previously said, that physicians, we are that human face of science. And so I think your point is spot on, that we have to share our stories. And I think that, again, there are numerous organizations represented within this room that are trying to tell that collective story and unify the voices of the health professionals. And that includes nurses and doctors and physical therapists. I mean, you name it, it includes all of us. And we are the ones who need to tell those stories, but you were right, we need to be better about sharing those stories because, again, numbers numb. This data is important and it's critical, but it's the stories that truly are going to reach that person in Kansas who needs to recognize that it's affecting their daughter.
And I would add that we actually need a whole host of different kinds of stories, because in different places we have different challenges, and in some places the challenges are going to be pretty substantial going forward. And so we need stories of how to engage with those challenges in a way that preserves human dignity and maintains opportunity, but also recognizes the severity of the challenges. In other places, we can focus, I think, more on opportunity, less on retreat, potentially. And we need to highlight how climate change mitigation promotes health. And it's always been a challenge in public health. How do you tell a story about something that doesn't happen? But that's what we need to do. And what does happen is that people live better lives. They live longer lives, they live fuller lives, they live happier lives. That's what we need to emphasize. And we need to highlight places that are doing that well in the United States and elsewhere. And then we need to support the places that are having trouble with that. And we need stories for all of it.
Great, well said. Mona?
Mona Sarfati, Medical Society Consortium, and the Center for Climate Change Communication. My question relates to the geographic diversity that we face in the United States. When you look at the map of where we have the biggest impact for climate change to date and where we have less impact, it reflects well the politics that we see in which the representatives of those areas that have less impact seem to be less concerned, and maybe their populations are less focused on the real impacts that we're seeing and that you're talking about so clearly and so well. And so the question is, how can we get the stories from those other states where there is to date, far less cognizance of the problem that we have and fewer people coming forward to address the problems? And when I look at that map of the western states and going down into Oklahoma, you see less impact from heat, less impact from some of the other most striking climate change effects. And so the question is, how can we find the people who can tell stories and help us get the message to those areas of the country that are not yet hearing us so well?
Thank you, Mona, for that wonderful question, and I think highlighting really a key thing. So again, teamwork, patients first. We have to, in my opinion, we have to build partnerships with the organizations, with the hospitals, with the public health departments who are already within those communities, because we need them to be able to reach out to their community and really seek those stories. And I think we have to be better about building that collaborative network across this country, so we don't have to recreate the wheel in every city, so we can share best practices. And so that way they can solicit those stories, and then the stories can be disseminated locally. Because, individual X needs their neighbor to be the one to share that story for it to really hit home.
And I would also add that there are impacts everywhere that you may need to go to different groups than usual to learn more about them and to get people to speak about them. But in many places that you were referring to, I would actually go get some stories from farmers and people who live in rural areas who are daily impacted by weather, see changes in weather over time, and notice changes in ecology. And they are exposed to wildland fires as well. They're exposed to drought. They're exposed to extreme heat and its impacts on agricultural workers, but also on crop productivity. They see the impact of all of these things in their work, in their communities, and in their collective wealth and threats to their collective wealth. And so I think the question isn't, are there impacts in different places? It's what impacts are there, and how do those connect to what people care about in those places? And then how do we connect with those people around those things that they care about and their health to tell the stories?
Great. Well, I have one question, if you will entertain it. How will this report empower non-experts or community advocates to take on either advocating for the solutions that have been outlined or doing more work in their community. And also, how will we engage those that are often overlooked, like low-income communities or tribal populations, indigenous groups?
I'll speak to the global report, and then Renee, maybe you can speak to the brief. One, I think the global report is valuable because it provides a comprehensive view of what's happening around the world. And though it's a little bit technical, it's pretty accessible and gives a very broad snapshot of what's happening elsewhere. And it, to some degree, benchmarks where we ought to be. And I think that's very helpful for us. It's a tumultuous time in the United States, but it's nevertheless important to recognize that we're part of a global community, and the global community is taking action, and we are a bit of an outlier. But here's what the world is doing and the trend that the world is on, and that's important to keep in mind.
So I think your last question is importantly critical. So a mentor of mine during medical school told me that 70% of the diagnoses can be made on a history. That means that we have to listen to our patients. We have to listen. And I think as a country, we aren't listening. And I think you highlight a community that we haven't listened to, so we have to go there and we have to listen to them, and we have to hear their stories. And I think that's how we engage them, and that's how we build community with them. Because we have to recognize that we're walking side by side with them, and we have to do it together, but we have to involve them. And the way to involve them is to listen.
Thank you. And of course, the report both talk about common sense solutions. So hopefully we can talk together about common sense solutions moving forward. So if you all will join me in thanking both Drs. Hess and Salas for their wonderful presentations and their hard work on the both reports. We're now going to take a 30-minute break. There's coffee and refreshments in the back where we had breakfast. And if you can all join in 30 minutes. Thanks.
back down, that would be great. I think people can hear.
Hi, everyone. We're going to get started in just 2 minutes, so please take your seats.
I don't know if I've been to an event where there's like a 40-minute break right in the middle.
You must have a little time.
I guess. No, I know.
All right, we're going to go ahead and get started. Please sit down. Thank you.
Hi, thank you everyone for coming back. Now we have an exciting panel before us, and I'm very honored to introduce to you our next speaker, or our next moderator. Van Newkirk is a staff writer at The Atlantic, and he focuses on politics and policy, and particularly on health policy. Prior to his time at The Atlantic, Van reported for the Daily Kos, where he worked on justice and health issues, and focused on an intersection of policy, race, class, and culture. Van's also worked as a policy analyst at Kaiser with a focus on researching health policy issues, and more specifically dealing with those disadvantaged and under-resourced communities. Van?
Thank you all for coming, and thank you to the Lancet Countdown, thank you to Climate Nexus and the American Public Health Association for inviting me. Also, thank you, I just got an alert on my phone. I'm a politics reporter first and foremost, and there's new news about the Mueller investigation, and I am very glad to not have to cover it. So thank you. When I first got news of the report and first got the top lines in the brief, I thought about a group of people who I might want to call to interview, to ask them about context, to get a sense of what I was looking at and what I was dealing with. And luckily for me, a good number of those people are right here on the stage with me right now, and I don't have to do any writing. I can just ask some questions up front right now. So what we'll do is we will start, everybody, I'll introduce everybody. We'll get a sort of a moment of context from everyone on the panel, some thoughts about what we should be meditating on, and some ways to guide the conversation moving forward. And then we'll get into it. So on the very far left, not actually politically, but on the far left of me, location-wise, we have Dr. Sam Adut, who is the chair of Virginia Clinicians for Climate Action and a pediatrician, a member of the Pediatric Associates of Alexandria, and also the lead author of the American Academy of Pediatrics Policy Statement on Global Climate Change and Children's Health. Dr. Adut.
Thank you. So yes, I'm Dr. Samantha Adut. I'm a pediatrician in Alexandria, and I'm proud to care for children from across the world and from all walks of life in my daily practice. And I'm also, as you said, chair and co-founder of Virginia Clinicians for Climate Action, which is a state affiliate of the National Medical Society Consortium on Climate and Health. And this consortium, which represents over half of the doctors in the United States through their medical societies, advocates for the rapid implementation of climate change solutions to protect the health and the welfare of our patients and communities. And as a pediatrician, I care for the children who are living the realities of climate change today. In the past year, I've cared for a 4-year-old boy named Louis, who came to Virginia after his mother's business was destroyed in Puerto Rico, and she moved here to be able to support her son, who has a rheumatologic condition. I cared for 7-year-old Janie. She's a girl who I met after her parents came to Virginia from Florida to escape Hurricane Irma. They found my name online as they looked for a doctor in an unfamiliar city to see their sick daughter. I cared for 3 families in the past year who were hosting family members who had fled Hurricane Florence in overcrowded homes. I care for the children who are having allergies and asthma attacks in February when the plants are blooming a month early. I care for the teenage athletes who get admitted for severe heat illness and kidney damage on one of the 5 excessive 95-degree days that we have in Virginia now, 5 more than we had in the 1980s. I care for the children who come home from vacations in Canada with Lyme disease, a place where it used to be too cold for Lyme disease-carrying ticks to survive. As this report makes abundantly clear, climate change is an unprecedented threat to the health and welfare of every child in my state, in this country, and in the world. And as physicians, we're prescribing an urgent transition to a clean energy economy that will ensure the safety and the health and the welfare of every current and future child. Thank you.
And next up, we have Dr. Ashish Jha, who is the Dean for Global Strategy at the Harvard T.H. Chan School of Public Health and the Director of the Harvard Global Health Institute. Dr. Jha?
Yeah, good morning, everybody. I was actually going to make some other opening remarks, but I'm going to use your cue. You asked me to...
you're going to do your 45-minute...
45-minute slide deck, is that okay?
That's fine, yeah, let's do it.
No, but you had asked me to talk about the... about climate change and health at Harvard, and kind of when I took on the Global Health Institute about 3 years ago, one of the things that became really clear to me was that the biggest threat facing global public health was climate change. And I said, well, you know, we're a university that likes to believe that we work on the cutting edge issues. I'm sure there are 30 scholars working on the nexus of climate change and health. And as I looked around, I found exactly zero. We have great climate scientists, great people working on health. The climate people couldn't really be bothered to think about the health effects, and the health folks thought climate is an issue that will surely affect us in the year 2100, but no one's going to be interested in working on it right now. So the journey for our university has been all about connecting the dots, and in that journey, I've come to realize that the same challenge that it takes to get a university ramped up and focused on a topic like climate and health and seeing the connection between the two is the same challenge we have much more globally, beyond our university, beyond other universities. And so we've taken a few different strategies on this. One of them is to remind people that health remains, for Americans, the most potent political topic and personal topic. For those of you who are aware of the little midterm election we just had a couple of weeks ago, the number one issue, certainly on the Democratic side, was health care. After 8 years after the ACA, it remains the most important and potent issue of our time. And yet, the biggest threat facing the healthcare system, the health of the people, is climate change, and that is something that I think almost nobody, doctors, nurses, healthcare leaders, certainly our political leaders, are not aware of. And I think that is our fault in the academic community, in the policy community, again, not having connected the dots for people. And so a lot of our work has been to try to lay out why, when there are things like the Superstorm Sandy, and you have your generators in the basement, and the generators get knocked out by the flooding, the hospital has to shut down, why that's a health problem. Why, when Baxter and others have their main plants that make those bags for IV fluids in Puerto Rico, and the storm hits Puerto Rico, I, as a clinician in Boston, can't give IV fluids to my patients, or not in the same way, and I have to change what I do clinically because of that storm. When you have outbreaks of Ebola in West Africa for the first time, the question is, why is Ebola in West Africa for the first time? The same case of Ebola that eventually ended up in Dallas and affected those nurses. That's because the demography of like where diseases are is changing because of climate change and other environmental changes. So these are very obvious issues, I think, to all of us in the room because we've been thinking about and working on them. I think our failure to, again, connect the dots, make all of that plain, has been a real challenge for us, and a big focus of the Institute and a big focus of our university, and I think a big focus for all of us in the room has to be to make plain to people that the effects of climate change are not what the temperature is going to be in the year 2100, but what the health of our population is going to be like today and tomorrow. Thank you.
And next we have Jeannie Economos, who is a pesticide safety and environmental health project coordinator for the Farm Worker Association of Florida and an advocate on behalf of working people in Florida and nationally in lots of other areas too.
First of all, I want to say I really appreciate the invitation to be here today. But while I'm talking, I don't want you to look at me. I want you to look over my shoulder, because behind me are hundreds of thousands of farm workers that are working every day harvesting the food that you all are eating, that we all are eating. And so I'm sitting here today, but I'm representing hundreds of thousands of farm workers in Florida and anywhere from 1.1 to 2 million farm workers in the United States. Let me just say that the Farm Worker Association of Florida is a very grassroots organization.
Again, you see me sitting here, but I'm one of the only white people on our staff. Most of our staff are Hispanic, Haitian, and African American. And most of our staff are former farm workers themselves, so they know the reality of what it's like to be a farm worker. We have 5 offices in the state of Florida. Our offices are based in the communities where we work, and farm workers are coming in and out of our offices all day long, every day. So we know the reality on the ground. For decades, the Farm Worker Association has focused a lot of health and safety work around pesticide health and safety of farm workers. But in recent years, we have understood the importance of heat and climate change on the impacts of farm workers who are working outdoors in some of the most difficult conditions just so that America can have food to eat. About 4 years ago, we began a community-based health study with Emory University looking at heat stress of farm workers. The study was just ended in September. And the study looked at farm workers in 5 different areas of the state and in 5 different crops. The study included a baseline survey that included demographic information, activities at work, et cetera. But then we also did biomonitoring, looking at blood samples and urine samples of farm workers and core body temperature. Farm workers swallowed a pill, and over 3 days we measured their core body temperature to determine what the effects were. Some of the findings, and I'll be brief because it's a big study, but we found that over 50% of farm workers started the workday already dehydrated. By the end of the day, at least 75 to 80% of the farm workers were dehydrated. Over 30% experienced acute kidney injury at some point during the day, and a large percentage of them reached a core body temperature over the NIOSH recommended of 100.4 degrees, and I think it was 10% reached 101.4 degrees, which is considered the danger level. I could go on. There's tons of data that we have from this study, and we're hoping to continue the study. But the point is that the people that are doing some of the most important work, in our country that we often think of as invisible because we don't even think about it, are exposed to some of the worst conditions and are most at risk from climate change impacts. So I'm happy to talk more about that later. Thank you.
Thank you. And next up, we have a man who I'm sure all of you know, Dr. Georges Benjamin, who is the Executive Director of the American Public Health Association. Dr. Benjamin.
Good morning, everyone, and thank you very much for joining us here today. This is a really very important report, and I just want to remind everyone that this report is not just being released here in the United States today, but it's being released in several other cities around the world in which there are city-specific reports. So this is a very important report. My staff always tell me not to say this, but I do it anyway. And it's remind people that we're old, at least APHA is. The American Public Health Association has been around since 1872. And I say that only to say that one of the things that I get to do in my job is I get to rummage around in the archives. And in doing so once, I found that we actually had a committee that reported on environmental health, which was reporting on the fact that the environment impacted our health back in 1923. So clearly somebody's been concerned about this from the health perspective. Someone asked about whether or not this is our lane. Yeah, it's been our lane. It was in our lane when the environmental sanitary movement occurred. It's been in our lane when it started hurting or killing people. So there's no question that this is clearly in the lane of people who are concerned about our health. About 1997, several of our members got very focused and involved in issues around climate change. And we've been off to the races ever since, looking specifically at the intersection between climate change and our health. Last year we held a meeting that was themed on climate change and health. This year we had a meeting themed on health equity, and there were many sessions that looked at the whole issue around climate and environmental health and health equity. And now you heard from Shirley Patel, who is our deputy in our policy center, that we're now going to launch a more specific effort and put our resources together in terms of a new climate center, which we think is important because there really is no comprehensive center looking at climate health and health equity. And so we're trying to lead that effort as well. There's, we'll have a great panel discussion, but I just want to point out the fact that one of the central challenges that we do have is trying to encourage people that climate change is here today and is impacting our health today. And the way I think about it is somebody was made sick yesterday from climate change, someone's being made sick today as we speak, and someone's going to be made sick from climate change tomorrow.
So I want to start by providing some context and then offering a framing question to the entire panel. We come here, I believe, in the middle of what seems to be a public renaissance and informedness about climate change and concern about climate change. We come here after the IPCC's report. We have the National Climate Assessment just a few days after the fires near Paradise, California were contained. We are only a little bit more than a year past Hurricane Maria's devastation of Puerto Rico. We saw and are still seeing there are a number of health effects of climate-related disasters today that might not be obvious and are being made obvious to the general public now. You're thinking about mental health issues following the hurricane in Puerto Rico and now following those fires. We now see people thinking about asthma and how it's related to climate effects also. As a reporter who writes often about climate change and health, two areas that don't often get a whole lot of love from the internet clicks as much as I wish they did. It's great, but also a bit of concern crept in my mind last night as I was compiling my notes. It seems as though we are benefiting from a bit of a train wreck effect. Lots of people like to look at the really worst case scenarios, worst case possibilities of a disaster, not necessarily in ways that will help them figure out how to deal with it. How do we, the people in this room and also the people in your fields, move from sort of the train wreck effect, which is often necessary for getting eyeballs and brains on the issue, to thinking about promoting health and promoting strategies for dealing with this? And anybody can take it if you want.
Well, let me start by just saying that I think that we have to think of this as the fact that health is a system. And it starts from, way upstream to the way we build communities, prevention and wellness and those kinds of things, all the way through, critical care. And even beyond that to really bad things, that big disasters. And what happens is, as you point out, we catch that snippet of whatever that big event is, whether it is a bad storm or fires or a cluster of people who are sick, and we don't look at the outliers. So the fact that people are still challenged with mental health problems from Hurricane Sandy today, the fact that people in Houston are still living in conditions which none of us would live, with walls that are broken, with moldy facilities, and also mental health problems. And tragically, again, even though we have recently had some good media coverage of those events, a year later, the public still doesn't have hasn't been riled enough that we need to do something. So the failure to do something up front, in this case, and then there's an additional failure to do something, even when we bring it to people's attention, that there's still challenges. And the fact is, it's just costing us more money and more heartache because we haven't addressed it.
Anybody else?
Let me just add one thing, which is, it's interesting. When one of the areas of public health that people often focus on is when you have disease outbreaks. There's a phrase people use that the way we deal with pandemics, et cetera, is we oscillate from panic to neglect. Right, when there is a big outbreak, everybody panics, we throw lots of money at the problem, and then the outbreak goes away, and then everybody says, we're all set, we'll wait. And so what the situation you describe is in some ways very similar, right? You get the big storm, the fires, and everybody's focused right now on climate change. 3 months from now, climate change will not have gone away as a problem. But we may not have the fires, we may not have another report, and then it'll sort of die out. And so the question is, how do you sustain attention and momentum when it isn't hitting you every day over the head from news reports? And my feeling is you can't do it in the public eye. The public just gets tired. You can't expect the public to constantly be focused on this, because in some ways they'll tune out. But one of the things that we've been doing on the pandemic side, which I'm hoping maybe we can adopt a bit here, is if you can lay out for people what the cost of neglect is, and it's real dollars, then you can build momentum for policymakers to work on, and practitioners and others to work on these topics, even when it's not in the news. That is fundamentally a challenge, because the way our human brains work is when there are fires, we go, oh my God, there's a big problem. But when those fires go away, everybody goes back to doing their day job. And we've got to explain to people that those fires this is not a perfect storm. It's not random. It didn't just happen. There are things that have caused it. They have real costs. And if we want to prevent those costs, we got to work on it when it's not in the news.
I'd like to talk a little bit about how the group that I work with, Virginia Clinicians for Climate Action, is addressing this. One is through education of the medical community, through bringing reports like this, the NCA, into the understanding of practicing clinicians, because there's quite a big disconnect between those of us who are deeply engaged in this topic and the research community and the actually practicing clinicians who are working with patients every day. So, and what we're doing is to bring educational events to bring this information to clinicians in the hospitals where they are. We're having partnerships with the assistance of Healthcare Without Harm with hospital systems, which are enabling us to get into hospitals, bring in nurses who are working there already, doctors who are working there already, and bring in the experts, some of whom are authors of the research that are included in these reports, and bringing speakers to these events so clinicians can actually start to understand that maybe my patient got sick with heat illness on that 95-degree day because there's more 95-degree days than there used to be. And it sounds pretty obvious, but in fact, it's not a connection that many people are making. Once we have educated clinicians, then we can go into our Virginia General Assembly, which we're doing this January 24th for the second year in a row, and saying we as clinicians are concerned about how these changes are affecting our patients. And that's why we want you to support this clean energy bill, because this isn't, this for us is an issue of the health and safety of the children that I care for every day, of the parents that I care for and grandparents that we care for. So I do think this is a two-pronged thing, and one is really educating the people on the ground so they can then go to their patients, and then they can go to their legislators and to the public through public outreach, through op-eds, and through other community events. So it's a huge opportunity, I would say, which is why we're growing very fast, because people want to hear from us. Clinicians are looking for people like us because they're understanding these connections, but they don't know what to do about it, and they don't have a mechanism on which to actually act on it.
Dr. Ardoud, I wanted to follow up with you with a question about the doctors in your specialty. We're talking about vulnerable populations by definition. They're the people in danger, in the most danger, in any crisis. I don't know that we talk about children as vulnerable populations in the way that we should. We saw with Zika, which has very specific effects on infants and children and mothers, sort of that focus, but we don't really see a whole lot of focus on how different infectious diseases are going to affect children. How do we reframe maybe our conversation around vulnerable populations in healthcare to accommodate for what's going to happen to children with climate change?
Well, I am very proud as a pediatrician that the American Academy of Pediatrics was one of the very first medical groups which published a policy statement and technical report on climate change back in 2007. So this has been an awareness. The unique vulnerability of children to climate change has been an awareness. We have been aware of this in leadership level with pediatricians for quite some time now. And there is the American Academy is engaging in more and more advocacy work on this level. So in terms of what we as pediatricians are doing, we are working to bring this issue, to amplify the issue within the pediatric community. And we have consistently spoke out, the National Academy, in support of the Clean Power Plan and other legislative efforts to address climate change. So, but it is just like it's an issue for all clinicians to start connecting these dots. It's similarly an issue for pediatricians. I think that's pretty much across the board.
Jeannie, I wanted to follow up on your opening remarks when you talked about the farm workers who are behind you, who are making, who are picking and producing the food that we are eating here. I've actually used some of the research you cited in my work, writing about the effects of heat on farm workers and laborers in Florida. We know that most of those folks are Latino, often undocumented, often migrant and guest workers, and often poor. What do we know about how climate change interacts with the lack of services and the health inequities we already see in those populations today, including the effects of heat, stress, but beyond that?
Well, let me just say, give a little picture of the reality for farm workers. In Florida, over 50% of the farm workers are undocumented. And because of the current climate, even before the current anti-immigrant climate, it was very difficult to get farm workers to speak out if there were bad conditions in the workplace. They're intimidated, they're harassed, they're terrified of speaking out. The conditions are very difficult. In terms of heat, farm workers tell us that they often don't, so most farm workers are paid by piece rate. They're not paid by the hour. So they're paid by how much they pick. The incentive for them is to keep working, to keep picking, to not take breaks, because if they stop, then they miss getting money from producing less. So there's an incentive for them to keep working. Because of that, they often don't drink water. And they don't drink water because they don't want to have to stop to drink water, and they might have to go to the bathroom, and they don't want to stop to have to go to the bathroom. There's also a lot of pressure from supervisors and employers for workers to keep working. A lot of times farm workers will wear diapers to work just so that they don't have to stop and go to the bathroom, so that they can continue working. The conditions are really very difficult and intense for workers, and it's really important to understand the climate that they're in, both the physical climate and the immigration climate that they're affected by. So that being said, I think we really need to change the systems of agriculture that we have, and we need to make sure that we have policies in there that will protect farm workers from heat stress. We see the effects of climate change on farm workers, both in terms of heat stress, but also in terms of the impacts of natural disasters that disproportionately affect the vulnerable communities. So it's really important that we open up our connection with clinicians and with policymakers to look at what these vulnerable communities are facing, because everybody's got to eat, and we depend on this workforce for our food. And so we need to protect the most vulnerable communities from these conditions.
Dr. John and Dr. Benjamin, you both mentioned the role of money and the role of thinking about value and how we frame all the risks of climate change. And I'm thinking of how effective one of the breakthroughs in public health has been communicating to people the risks of health problems based on how much they're going to cost them. I know in the report there are metrics about lost labor hours and about how much the billion-dollar damages that are caused by disasters. How do we marry the public health success of communicating risks by cost with this emerging paradigm in climate change?
Let me start by saying, I think first, this is a place where we actually just need some more data. Not data on whether climate change is having effects, but quantifying. Look, at this point in America, depending on how you measure it, between half and 2/3 of all health care is paid for by the U.S. government. Medicare, Medicaid, all the federal programs, state programs, et cetera. So if you have changing climate leading to more emergency room visits, more doctor visits, more hospitalizations. Guess who's paying for all of that, right? We are as a society. And that is a easily, in my mind, easily quantifiable cost that we just have not done a good job of quantifying. We can and we should. But that helps remind policymakers who say, oh, you know, people's electricity bills are going to go up. We can't do this because of the cost. We'll kick the can down the road. We're already paying for it. We're just paying for it through a different line item in our budget. And just helping people understand how much more we're paying. Forget the health effects, which are, of course, the most prominent issue and the most important, but just the financial impact it's having on our country, on our government right now, I think is a really important part of the conversation. I just don't think we've quantified it well enough yet to have that, and we ought to.
Yeah, I would agree. The idea of measuring both the cost avoidance and the savings, and then translating that to savings to taxpayers is important. And you know, we always get this whole argument that people will lose their jobs. And my retort as physicians, people will lose their lives. You know, you can't work if you're dead. And that sounds so simple, and it sounds kind of a simplistic approach, but we're not talking about that as though it's, you know, I'm not trying to be reactionary or scare people. It's real. You know, when someone's out working, a farm worker is out working, and they're out there in the heat, and people die from this. We see this each and every day. Our colleagues see this in the emergency department each and every day. You know, imagine a future where we actually, when we did our list of diagnoses, we also had an ICD-9 code for climate change-related diseases, and we could just kind of measure those. Imagine a future where physicians, in addition to writing prescriptions for their medicines, their patients for medication, or as my good colleague, Dr. Dave Satcher, used to do when he was Surgeon General, he gave everybody a prescription for exercise and good eating. Imagine writing people a prescription to protect their health for climate change, which said, you know, you have the following medical conditions, you want to protect yourself from climate change, do the following things at home, do the following things to protect your health, and do the following things when you engage your elected leaders. I think people would finally get the message.
You mentioned Dr. Satcher. I began my public health training with him at the Morehouse School of Medicine, and I've watched the social determinants of health model, you know, really morph into probably the dominant model of thinking about public health and health as a system in this country. And it talks a lot about health disparities and the legacy effects of all these social systems that go beyond what we think about as generally health. Do you think that that paradigm in epidemiology and public health is capable of keeping up with all the new data it's going to have to absorb from climate science, from thinking about issues that go beyond even this really broad net that we have cast with the social determinants model?
Yeah, you know, we have a lot of data, and I think the first question is making sure that we actually utilize the data that we really need to have. And when you can put 100 data sets on the table, you got to decide which ones are the most important and focus on those. And far too often we try to focus on too many. But we've built the society, we've designed the society exactly the way to give us results that we have, right? We've built a society that's built on fossil fuels. It's getting us a sickening planet and it's getting sicker people. If we built a society based on clean energy, which we have the tools and technology now to do, then we can certainly build a society that will generate a healthier community. If we build communities that are walkable, bikeable, and green, they'll be quite different. But the energy that drives them, and it's all about energy at the end of the day, needs to be clean, renewable fuels. And the tragedy is we have the science to do that, and we have the data that is just being rolled out each and every day to prove that point. In many cases, this is not a scientific discussion. This is a hardcore political discussion. And while there are clearly many people in the health world that are uncomfortable with the raw politics of this, I'm not anymore. And I recognize that we got to fight fire with fire, and we've got to push political leaders to the brink to make them to do the right thing.
Dr. Adut, the piece of this report that to me as a Carolinian who has dealt with lots and lots of mosquitoes over the course of my life really got to me was the one on vector-borne diseases and thinking about those and also the rate of increase of infectious diseases. The piece on Vibrio was really striking and kind of horrifying. I am interested, though, in taking it a step past that and thinking about the risks we don't see. We're talking about children who may face infections, who may face extra days out of school. You know, we've seen the same thing happen public health-wise with lead poisoning, all these externalities to consider. How do you factor that into your work, and what are things that we might not be seeing in this report and currently in our paradigm about climate change that you might be seeing?
Well, as a pediatrician, a lot in the United States, much of what the patient's infectious diseases today are viral infections, you know. And in fact, we know virtually nothing about the common pediatric viral infections and how they're affected by climate change. Coxsackie virus is an enterovirus, which there is a fair amount of data now which shows that's hand, foot, and mouth disease, you know. I mean, that's bread and butter pediatrics, which I see very regularly. And there's pretty good data now that Coxsackie virus does increase in prevalence with warming temperatures and humidity. But I don't think that's gotten quite that much attention. Similarly, things like RSV, respiratory syncytial virus, it's the most common cause of child hospitalization in the wintertime. For some reason in Florida, it's all year round, and the rest of the country, it's in the seasonal. It's in the wintertime, you know. And why is it all year round in Florida? I have no idea. But it'd be very interesting to know, because with warming temperatures, what's going to happen to RSV? So there's a lot of viral infections that I would love to know a lot more about, because and now, of course, there's the new enteroviruses, which are causing a paralytic condition. And I have not seen anything relating that to climate change, but I think it's a very important question.
So I have a couple more questions for the panel, but I do want everybody in the audience to start thinking about your questions, and I'll ask you. What's that? Oh, we're not doing questions, sorry. But still start thinking about questions. Dr. Jha, I want to go back to what you said in your opening remarks and meditations. We're really clear on the role of universities in health in terms of research, in terms of academic medical centers, outreach and satellite facilities, and really being the centers of both the public health and the personal medical apparatuses in the country. Now that we're doing so much connecting this to the apparatuses of climate and climate change, what do you envision as a role of the university in addressing climate change?
It's a great question. Let me say a couple things. One is let's talk about academic medical centers and just hospitals in general. So as you may know, the healthcare delivery system represents about 10% of all greenhouse gases in the United States. So one clear opportunity for the healthcare delivery system is to decarbonize itself and to substantially reduce its own carbon footprint. And that's a place where I think academic leadership and universities can play a big role, because all the academic medical centers, almost all of them are affiliated with medical schools and universities. And so we are actually launching a new initiative where all the Harvard teaching hospitals are going to come out, are making a commitment to substantially reducing their carbon footprint, not because we want to stop at the Harvard teaching hospitals or that they're particularly egregious, but if we're going to make this a major cause of universities, we should begin at home with our own academic medical centers. And the idea becomes that we will then work with other universities to get their academic medical centers, and it should spread out really across the country. So one really important part of universities is, if we're going to advocate for these issues, is we should begin by looking at our own institution and making sure that we're doing everything we can. The second part is universities, I think, are the kind of engine of knowledge generation. We like to believe that the science on climate change is settled. it is settled that climate change is occurring. It's created by greenhouse gases. That part is settled. There's a lot more to understand about what the impacts are going to be in our society, who's going to be affected, how we do mitigation. The universities have to continue to be at the forefront of doing that kind of scientific work. And then the third part, where I think universities tend to not be so good, but I've been pushing ours and others, is on communicating the science. There is a very large gap in our society, increasingly so, between the scientific community that feels that their job is to figure out the science and hope that everybody understands it, and the rest of society that's feeling more and more alienated from that community. And so universities have a very important role to make sure that science that we're generating, that the government is often, the public is often paying for, is explained to the American people so people understand where their taxpayer dollars are going and why it's so important.
So I want to close very quickly with a question that I'm going to pose to everybody. We saw in the keynote, Regina said that carbon pollution is not an equal opportunity killer. I am interested as a journalist in how we take what we know about health disparities, what we know about environmental injustice, what we know about the basic slant of inequality in this country, and how we go about aggressively applying that to our understanding of climate change. What is, I want to ask, just coming down the line, starting with Dr. Adut, what is one part of your work that we can apply this framework of disparities, of the basic inequality of American life, and understand better how that's going to affect climate change?
So I would say what keeps me up at night and what propels me in this work is that children don't have a voice on an issue that's probably the most important issue that's going to affect their future, their families, their ability to raise their own children in a safe and prosperous world. And for pediatricians, I feel that this is probably the most important issue that we should advocate on behalf of our patients to protect their future. So I see this as really an issue of unprecedented intergenerational justice, and as a pediatrician, I work every day to help the public understand why this is critical for the future of children.
Thank you.
You know, as you were talking, Vaughn, I think about how the military often describes climate change as the ultimate threat multiplier, right? That it doesn't create new threats, though it sometimes does, but it takes all the existing threats and makes them much worse. And in the same way, when you apply that lens to health, you know, we have health disparities. We had it before climate change. Even if we solve the problems of climate change, health disparities won't go away. It's just going to make every one of those health disparities and all the other social challenges just that much worse. And so that is a framework that I think is very helpful in understanding why carbon pollution is not an equal opportunity offender. The people who are least able to deal with and be resilient to the negative effects of climate change, farm workers, kids in areas where the air quality is already pretty poor, the elderly who are already kind of marginally getting by. Those are the people who are going to feel this first. They're going to feel it the most. And so we have two options. I mean, in my mind, not two options, two strategies. One is obviously that we need to work on climate change itself and find ways to mitigate. But the second is we've got to redouble our efforts on health disparities and the underlying social factors, because without addressing those, climate change is going to make all of those disparities much worse.
Thank you.
Well, this is going to be a little bit different. The number one contributor to climate change is actually agriculture. Both animal agriculture and crop agriculture, it's the number one contributor for many factors. So part of what we need to do is actually change our system of agriculture. And that's one of the things that the Farm Worker Association of Florida is working on. We're looking at principles of agroecology and food sovereignty, and that actually addresses disparities. It's a very small movement around the country, but it is a movement. And so one of the things that we're doing and grassroots groups around the country are doing are we call them community gardens, but for the Farm Worker Association of Florida, it's much deeper than that. It's a form of resistance against corporate agriculture, and that includes the discrimination against minorities in agriculture, but also it's a way to try and transform our agricultural system, because not only do we need different energy sources, clean energy sources, but we also need to change. If we don't change the way we do agriculture, we're still going to have many of the same problems, and that includes pesticides and depletion of our soils so that you have less carbon absorption in the soils. It's very complex, but that's really critical and really key, and I think we need to keep an eye and a focus on that too. So one of the things that we're doing is trying to give power back to farm worker communities by helping them to learn about agroecology and food sovereignty, and to help empower them to know their own rights. And in that way, we're trying to fight for justice for farm workers, both in health equity, but also in terms of their own empowerment, and trying to reach out in collaborations with partners and allies around the country. So this, for us, this is not only a policy issue, but this is a public health issue and a social justice issue, and that's why we need to empower farm workers to advocate on their own behalf as well.
Thank you.
You know, I always struggle to try to figure out how to get Mrs. Jones and Uncle John to care about this at the kitchen table. And for me, I think one of the messages I want to leave us with is that climate change is a civil rights issue. You know, all communities have the right to clean air, safe water, and it's also the ability to recover equally when disaster strikes. We don't have that system in place right now. That does not what happens to our communities right now, but we know how to do it, and we ought to be able to design a system to give us that, just that.
Thank you, Dr. Benjamin, and thank you all our wonderful panelists, and thank you for inviting me to moderate this, and thank you everyone for coming.
I can echo. Thank you for the wonderful panelists. You all did a fantastic job. And what a great union between a reporter and public health or medical professionals talking about climate change and health and asking those really tough questions that will help society at large understand the complex issue. So thank you all. Next, we have a couple words from our host. If Ted can come up, please.
Hi, everyone. I am Ted Eaton. I'm the medical director of the space, the Kaiser Permanente Center for Total Health. So welcome. And I thought what I would do, this has been great to hear everyone's voices, and I wanted to share how much we are with you and who we are, give you some numbers, and then show you how we demonstrate it in the walls and displays of the Center for Total Health, so you can experience it yourself as you're having the delicious lunch that is coherent with our sustainable food policy in the back. We are all here, and by the way, I'm a family physician. I work for the 22,000 physicians, Permanente physicians of Kaiser Permanente, and both ourselves and all of you here, we're all here to shape the future of healthcare. We are 22,000 physicians, 58,000 nurses, 270,000 employees, 12.2 million members, and serve in communities that house 68 million people. So that's really important to us because this is ingrained into the way we think. We don't just think about the people we take care of. We think about the environment around our buildings and around the people that we take care of. If you know Kaiser Permanente, we are the largest nonprofit integrated health system, and we're paid for health. When you're paid for health, you know that you have a responsibility to support health at every opportunity, including the environment and reducing the impact of climate change. We also have the benefit to have arranged great parents, Henry J. Kaiser and Sidney Garfield. And I bring that up because they were also very passionate about the environment and the inextricable link between environment and health. As you are all leaders for a generation of health professionals who will follow you, that will ground them in what they need to do to improve the environment. So here are some numbers for us, and then I'll tell you about what's in the center. So Kaiser Permanente plans to be carbon neutral by 2020. We have achieved a 29% reduction in net greenhouse gas emissions since 2008, while increasing our membership 36% in the last 10 years. We are now, we will be, or are going to be, the largest purchaser of renewable energy in the U.S. healthcare sector. In September, we finalized the agreement to purchase 180 megawatts of renewable energy, which will power 27 of 39 of our hospitals year-round. We are participating in the construction of wind and solar farms and one of the largest battery energy storage systems in the country. So again, a health system doing this. Over the next decade, Kaiser Permanente plans to spend $42 billion on capital projects, with a commitment to LEED, Gold, or Platinum certification for hospitals, offices, and other major projects. So this is ingrained into the way we operate our health system. It's not separate. If you're interested, you can go to a special microsite, kp.org/green, and you'll see we have a comprehensive approach to the environment, which includes climate, food, which we just talked about, waste, water conservation, safer products, management and accountability, and collaboration. So it's one thing that's nice about being a physician here, being a part of Kaiser Permanente, is that everything we do is related to the patient in front of us and the community around us. So you can see it integrated here into the Center for Total Health for those of you that are here. So I will point out there's the map there on the digital wall. You can zoom in on any city, and when people come here, we show them the footprint of vulnerable populations, and you can see that many of them are located near freeways and airports. The impact of where people are located that are vulnerable. You can look at the stories in the digital wall in Boston, which is Healthcare Without Harm. You can look in Seattle, which is our LEED Gold Hospital in Hillsboro, Oregon. You can also look around the corner here, which is our LEED Platinum Hospital in San Diego, and I'm, of course, here as well. So the message is that we're here with you. We do this every day, and we can do this together. So thank you for coming, and enjoy your meal.
We have a few closing remarks. And I just want to say that I'm so enthused by all of the conversations that I heard ongoing. And really, as we try to build teamwork, it was about bringing this community together. And it was so great to see all of you connecting, because that was one of the inherent goals around this. And here, we're going to work to put patients first. So we have a lot of thank yous to do. First off, I want to thank the Lancet Countdown, and especially for giving Jeremy and I this opportunity. There are launches happening around the world today as we speak, and so we really stand together as a united global front around this issue. I also would like to thank the APHA for your critical leadership on this. I'm so excited to see how we can advance this further, especially with your forthcoming center. I especially want to thank Climate Nexus. They have been a critical partner in this. Paige Knappenberger deserves all of your thanks. She put this event together. She was one of the other authors on this brief. And we couldn't have done it without the Climate Nexus team. So thank you all, Climate Nexus team in the back. Kaiser, thank you so much for donating this space. This is such an amazing space. And for your leadership in climate and health in the healthcare sector. And for all of our partners who made this possible, again, this was all donation-based. That's the only reason this event is happening. So thank you so much for making this happen. And I also want to thank all of our sponsors, especially around the other medical organizations. So thank you, Mona Safferty, for really highlighting the Medical Society Consortium power. And a lot of them, again, are standing with us in sponsorship. More importantly, to all of you in the audience who contributed to this brief and were a part of our key advisor team. Again, this would not have happened without you. We truly are standing on the shoulder of giants as we move this forward. And thank you for the leadership of all of you in this room. With that, I'm going to turn it over to Jeremy for some closing remarks.
I'll say one additional thank you to Renee, who has burst upon this scene with amazing vigor. And her vision for bringing everyone together is the reason that we're all here today. She's indefatigable, and I'm proud to work with her. So I want to appreciate her here. And I stand between you and a delicious lunch. I just want to say, go forth. We are reframing climate change as a health issue. Fundamentally, that's what it is. Hopefully you've learned something today that you will take with you to conversations going forward. I encourage you to have difficult conversations and bring up health, bring up climate change and the links between them. Thank you.